The decision to undergo a vasectomy remains shrouded in uncertainty, insecurity, and conflicting information for many men. Despite advancements in medicine and the procedure's growing acceptance, numerous doubts persist, fueled by taboos, prejudices, and antiquated myths. In this video, we delve into a candid conversation, addressing real questions to guide you in comprehending everything about vasectomy. Without mincing words, using straightforward language and real-life examples, we'll tackle the 10 most frequent inquiries men pose when contemplating this option. To start, let's be direct. What is a vasectomy? It's a surgical procedure that aims to prevent sperm from being present in ejaculation. In practical terms, the ducts that carry sperm from the testicles are blocked or severed. The body continues to produce sperm as normal, but they are reabsorbed by the body. Both the volume and appearance of semen remain unchanged. Neither does sexual pleasure. What changes is the possibility of causing a pregnancy. While many men feel apprehensive when they hear the word surgery, vasectomy is, in fact, one of the simplest procedures within urology. Performed under local anesthesia, it does not require hospitalization and typically takes approximately 20 minutes. Recovery is generally comfortable, and in a few days, it is possible to resume normal activities, including work and driving. However, rest is crucial during the first 2 days, particularly to prevent swelling and discomfort. One of the most frequently asked questions is, "Doctor, will I still feel pleasure?" And the answer is yes. The sensation of pleasure, orgasm, libido, and erection remain exactly the same. None of that is affected by surgery. What will no longer occur is the presence of sperm in the semen. However, this change is imperceptible to the naked eye, and above all does not alter the sexual experience in any way. However, not everything happens overnight. After the surgery, there is still residual sperm in the vas deferens. Therefore, it is crucial to continue using contraceptive methods for approximately 2 to 3 months, or until 25 ejaculations have occurred. Only after this period is a semen analysis performed, an examination that confirms whether the man is indeed infertile. Another common question is, can I reverse my decision if I change my mind? Technically, there's a surgery called vasectomy reversal, but its success is not guaranteed. The time since the vasectomy, the technique used, and factors like the man's age have a significant influence. Therefore, when considering this procedure, it's best to treat it as a permanent solution. The decision should be made with clarity, conviction, and through open dialogue, especially if a loving relationship is involved. Regarding age, many believe there's a limit. However, legally speaking, in Brazil, a vasectomy can be performed from the age of 28, or for men with at least one living child. Nonetheless, a medical evaluation is mandatory, and a consent form must be signed, with a 60-day reflection period. There's no upper age limit for the procedure, provided overall health permits it. Another point that often causes anxiety is, what if I'm not sure about wanting children in the future? In this case, the most prudent option is to undergo sperm collection and freezing before surgery. This way, if life circumstances change and the desire to have children arises, you will have this possibility through assisted reproductive techniques. It provides an extra layer of security and brings peace of mind to the decision-making process. The fear of pain is also quite prevalent. But let's dispel the myth. Discomfort is minimal. The patient only feels the local anesthetic, and recovery is typically swift. Some men report mild sensations of pressure or discomfort for a day or two. With the use of pain medication and rest, well-being is swiftly restored. And here's the call to action that makes a difference. If you're finding this content valuable, why not subscribe to the channel right now? It helps us keep delivering clear, straightforward information that truly makes a difference in your daily life. And while you're at it, chime in with your thoughts in the comments. What have you always wanted to know about vasectomy but never dared to ask? Your question could become the subject of our next video. We now address a question that many hesitate to voice aloud. Does a vasectomy make me less of a man? This inquiry, unfortunately, still reflects an outdated cultural perspective. A man's virility is not contingent upon his ability to impregnate someone, but rather on his responsibility, maturity, and capacity for conscious choices. A vasectomy, in actuality, is an act of courage and care towards one's own body, one's partner, and the future. In fact, contrary to popular belief, sexual life tends to improve after a vasectomy. This is because the worry about an unplanned pregnancy disappears, alleviating tension during intercourse. Many couples report an increase in intimacy and freedom in their sexual lives following the procedure. As for the health consequences, serious and long-term studies have not found a correlation between vasectomy and an increased risk of diseases such as prostate cancer, cardiovascular disease, or hormonal decline. The procedure is safe, well-established, and recommended by medical institutions worldwide. And here we answer another question. Who cannot have a vasectomy? Men with active genital infections, untreated coagulation problems, or those under psychiatric evaluation for impulsive decisions should wait. Vasectomy requires sound judgment. Physicians also assess personal and family history, precisely because it's a procedure with a direct impact on reproductive life. And what about regret? Despite being rare, it does happen. That's why follow-up with professionals is crucial. Some men regret their decision not because of the surgery itself, but due to life changes. A new marriage, the loss of children, a desire to start a new family. All of these factors need to be carefully considered. Finally, it is crucial to emphasize the partner's role. The decision regarding a vasectomy should be a collaborative one, discussed, shared, and thoughtfully considered together. In many instances, the woman has already undergone multiple hormonal methods, experiencing undesirable side effects. Vasectomy, being both straightforward and effective, emerges as a means of equitably distributing the responsibilities of family planning. We conclude our journey with a more empathetic perspective. Vasectomy is not merely a medical procedure, it is a life choice, an act of foresight, of planning, of someone who desires a more tranquil and secure sex life. It is a gesture of maturity and autonomy. Every man who chooses to have a vasectomy has a story. Some are already parents and feel their family is complete. Others never wanted children and wish to maintain the freedom of choice. There are those who have had difficulties with contraceptives and want to share this responsibility with their partner. All these stories are valid. Therefore, since you've reached this point, I'd like to extend a special invitation to you. Subscribe to the channel right away, not only to support this type of content, but also to join a community that shares knowledge, exchanges experiences, and embraces authentic stories. Share your story in the comments. What's your experience with this topic? Have you had a vasectomy? Are you afraid of it? Do you know anyone who has undergone the procedure? What did you learn from this video? Let's cultivate a space for exchange, respect, and collective learning. Your experience can be incredibly helpful to many.